Could a heart attack or stroke start from something you'd never expect? Have you ever stopped to wonder if some health problems, especially ones we often think are unrelated, might actually start from a hidden place within your own body? Today, we're going to explore one surprising root cause behind heart attacks and strokes that many people have never heard of, backed by compelling research and respected medical analysis. Multiple medical studies have shown that in a significant percentage of patients who suffer from heart attacks, myocardial infarctions, and coronary artery blockages, researchers have detected the DNA of infectious pathogens commonly associated with infections originating from teeth that had undergone root canal treatment. This finding is truly alarming, but the bigger question remains: what are these disease-causing biofilm microorganisms doing in your heart? How did they get there, and what does your dental health have to do with it? In fact, some evidence even shows that these types of bacteria are also present in blood clots found in certain stroke patients. Let me share a quick personal story. Some time ago, I went to the dentist for a routine checkup. They had this impressive device called a 3D cone beam imaging system. It scans deep into the roots of your teeth and reveals hidden signs of potential infection. When we looked at my scan, I saw a large dark circle around one of my tooth roots. The dentist confirmed it was an infection, an abscess beneath the tooth that was actively eroding the bone, even though I hadn't felt a single symptom at the time. Many medical experts who have studied this issue in depth have discovered that chronic long-standing infections, even those that are silent and show no obvious symptoms, can be a hidden cause of a wide range of serious health problems. These issues don't just affect the cardiovascular system, but also the joints and other vital systems throughout the body. One of the most common conditions is chronic apical periodontitis, a type of deep gum infection that often develops quietly without the patient ever realizing it. When you chew bacteria from infected areas around the roots of your teeth, can enter the lymphatic system in the jaw, and from there spread throughout your body. Every year, millions of people undergo root canal treatments, and one growing theory suggests this. The tiny dentin tubules inside the tooth may be the hidden blind spot in the treatment process. During a root canal, dentists remove the inflamed pulp, disinfect the canal, and seal it. But here's the concern. Your tooth contains thousands of microscopic tubules so small and numerous that it's virtually impossible to eliminate all lingering pathogens. Even more concerning, removing the pulp also removes your tooth's natural immune defense system, which normally helps fight infection right at the source. As a result, many people unknowingly develop silent abscesses or experience reinfection after treatment. In numerous cases, those same individuals later face cardiovascular issues, including heart attack and stroke. Ironically, traditional dental X-rays often miss these hidden infections only with advanced imaging. Like cone beam seat, do these hidden dangers become clearly visible? Many people have shared that they lived for years with persistent symptoms: chronic fatigue, joint and muscle pain, widespread inflammation, even brain fog or unexplained neurological issues, until one hidden infection in a tooth was finally discovered and treated. One common method for detecting inflammation in the body is a blood test that measures CRP C-reactive protein, a biological marker indicating that an inflammatory response is underway. These hidden infections can reside not only in the teeth or gums, but also deep within the jawbone or in other areas like the tonsils. Long-term exposure to these pathogens, especially when the immune system is too weak to keep them in check, can silently disrupt the body's balance. This often leads to oxidative stress, a harmful condition where the production of damaging free radicals overwhelms the body's natural antioxidant defenses, causing injury to tissues and organs throughout the system. Just think about this. Your mouth contains over 500 species of bacteria, viruses, and fungi. If left unchecked, toxins from these microbes can trigger powerful inflammatory responses that don't just stay in the mouth. They can spread throughout the entire body, becoming a silent burden on your overall health in ways most people never imagine. One of the body's natural responses to chronic inflammation is the formation of blood clots. And this is the direct link to the increased risk of heart attack and stroke. If you often feel fatigued, notice your immune system weakening, and suspect your body may be under excessive oxidative stress, there's a simple yet effective option worth considering. Taking liposomal vitamin C at a dose of around 12 grams per day. Unlike regular vitamin C, which mainly helps correct deficiency, liposomal vitamin C acts as a powerful antioxidant, helping to relieve the burden of free radicals on your cells. What makes this form unique is its ability to penetrate directly into the intracellular space, where most metabolic activity and oxidative damage occur, allowing for deeper, more effective support and recovery. The best way to take it is by splitting the dose into smaller amounts, such as 500 milligrams several times throughout the day, to maintain steady levels. Since vitamin C is water-soluble, it's easily flushed out through urine if taken all at once. Another benefit: liposomal vitamin C is much less likely to cause digestive upset or diarrhea compared to other high-dose forms. That said, it's important to be clear. Liposomal vitamin C is a supportive strategy to help reduce oxidative stress and improve your body's resilience to chronic inflammation. It's not a direct treatment for underlying causes like dental infections or heart disease. If you begin to feel better, that's a good sign and a reason to dig deeper into the root cause. It might be your diet, lack of sleep overexertion, or even a hidden dental infection quietly triggering inflammation from within. Now, if you discover an infected tooth, especially one that has already had a root canal, but still shows signs of trouble, this is a decision that requires careful consideration. It's best to consult with a qualified specialist to determine the most appropriate course of action. Why is keeping an infected tooth risky? Because the root canal system is incredibly complex, making it nearly impossible to remove all bacteria completely. Even if the initial root canal treatment appears successful, harmful bacteria can remain, causing a chronic low-grade infection that silently releases toxins into the body for years. When should you consider tooth extraction? If a tooth that has undergone a root canal continues to cause pain, shows signs of recurring infection on imaging. Especially with cone beam CTOR, if you're experiencing unexplained systemic symptoms that may be linked to that tooth, then extraction is a reasonable option to explore. Many people have reported significant improvements in their overall health after removing these problematic dead teeth that had been silently contributing to chronic issues. Restoration options. After tooth extraction, dental implant. This is the most common solution. Zirconia implants, a ceramic-based option, are gaining popularity as a more biocompatible alternative to traditional titanium, especially for individuals with metal sensitivities. However, the cost of implants can be quite high. Dental bridge. This method involves reshaping the adjacent teeth to support the bridge, which may compromise otherwise healthy teeth. Removable denture. A more affordable option, but it can be less convenient and may interfere with daily comfort or function. How can you find the right dentist? Look for practitioners who take a holistic approach, also known as biological or holistic dentists, those who understand the connection between oral health and your overall well-being. Don't hesitate to ask questions about their experience in managing chronic dental infections and the types of materials they use in treatments. Another barrier many people face when it comes to thorough dental care is cost. Exams, treatments, and follow-ups can be expensive. That's why it's so important to take preventive steps now before more serious and costly problems arise later. Take proper care of your teeth by brushing at least twice a day using dental floss and rinsing with a gentle dentist-recommended mouthwash. Adopt a heart-healthy diet, limit sugar and processed foods, and eat more leafy greens and fresh fruits. Visit your dentist every 6 months for checkups that can catch problems early. If a root canal is recommended, take time to research your options. Consider getting a second opinion and choose a dentist with strong experience and access to modern imaging and technology. This is only a general overview of a complex and important topic. I strongly encourage you to explore more through trusted medical sources for a deeper understanding. If you have a personal experience related to this, feel free to share it carefully in the comments. Your story might help someone else. But remember, this is personal sharing, not a substitute for professional medical advice. Finally, the information in this video is for educational purposes only. It's meant to raise awareness and share knowledge. It should not be used as a substitute for medical diagnosis or treatment. Always consult your doctor or dentist for guidance on any health-related issue.